Hello, my name is Edwin Wogu. I am a student of UMass Global. I am going to discuss therapy modalities, CBT, REBT, and MBCT. Do you have my consent to record your voice?
Yes, you have my consent, Mr. Edwin.
Thank you. Now I'm going to do the brief overview of the patient. Patient B is a 35-year-old African American female who lives with her two children. She is separated from her husband for the past 1 year. The husband was the main income earner and paid all the bills. Patient presented to the clinic that I am hopeless. I feel the whole world is against me. I feel depressed. I don't have interest in things that used to pleasure me. I sleep excessively and I have gained 20 pounds weight in the last 3 months. Patient has a past psychiatric history of major depression. Patient was diagnosed for major depressive disorder recurrent episode on this visit. Identifications of 3 psychotherapies I'm going to use for this presentation. Cognitive behavioral therapy, rational emotive behavioral therapy, and mindfulness-based cognitive therapy. Define key words concepts. Cognitive therapy is a type of psychotherapy that states that thoughts, feelings, and behaviors are all connected and that individuals can overcome difficulties and meet their goals by identifying and changing unhelpful thinking, behavior, and emotional responses. Therapy, which is psychotherapy, also called talking therapy, is a type of treatment aimed at relieving emotional distress and mental health problems. Rational therapy is currently called emotional behavioral therapy. Rational therapy is therefore a psychotherapy aimed at resolving emotional and behavioral problems, disturbances, and to help people live happier and more fulfilling lives. Emotive therapy is a type of therapy used with regard to something that makes you have intense feelings rather than just having intense feelings. Briefly, briefly define each psychotherapeutic approach. Cognitive behavioral therapy is a form of psychological treatment that is effective in treating depression, anxiety disorders, alcohol and drug use problems, etc. Rational emotive behavioral therapy is a type of CBT that focuses on changing irrational thoughts or beliefs that negatively affect a person's emotions or behavior. Mindfulness-based cognitive therapy is a modified form of cognitive therapy that incorporates mindfulness practices that includes present moment awareness, meditation, and breathing exercises. It is used to relieve relapses in people with major depressive disorder. Identify why each individual approach is appropriate to the case. Cognitive therapy, cognitive behavioral therapy is appropriate to treat depression because it makes you aware that you have the depressive thoughts and teaches you to change them with more positive thoughts, feelings, and behaviors. The rational emotive behavioral therapy is appropriate to treat depression because it helps the depressed individuals to recognize negative thoughts, feelings, and replace them with healthier and more positive beliefs. Mindfulness-based cognitive therapy is appropriate to treat depression because on average, MBCT helps individuals who have recurrent depression to reduce the risk of relapse by 50%, regardless of their age, sex, education, or relationship status. The discussion of overall expected encounter with the sample patient. The overall encounter will be that the patient will start practicing positive self-talk. Patient will change the irrational thinking, feelings, and behaviors to rational ones. Patient will use practical self-help strategies to improve quality of life. Example of how these three modalities can each benefit a person with different culture or diverse background. Cognitive behavioral therapy benefits a person with different culture by being effective for ethnic minorities with diverse mental health problems. REBT challenges a person's negative thoughts and beliefs before the person experiences an adverse outcome due to their beliefs. MBCT educates those individuals on how they can become more aware of their thoughts and moves, not showing trapped in negativity. Summary of conclusions favorable to the synthesis of choices. These modalities are psychotherapies that are short-term to medium-term in their length of treatment. They all share the same goals of adjusting an individual immediate reaction, thoughts, feelings, or experience events. All the three modalities are used to reduce relapses of depressions through educating individuals concerned to practice positive self-talks to change the negative thoughts, feelings, and behavior. Hello again. Last time we met, we said we are going to start therapy today, and that therapy will be in 3 segments. Segment 2, which we are doing today, is CBT. Segment 3 is RECT, and segment 4 is MBCT. Now, the segment 2 is cognitive behavioral therapy. Like I discussed before, it's a form of psychological therapy that is effective in treating depression, anxiety disorder, alcohol and drug use problems, etc. And to learn practical self-help strategies. It also helps to identify and challenge unhelpful thoughts and to learn practical self-help strategies. In this therapy, we are going to use positive self-talk to address your negative thinking. What is positive self-talk? Positive self-talk, self-talk positive things about yourself, think positive instead of negative. Associate with people that think and talk positively. When you say, I am hopeless, I feel like the whole world is against me, these are negative thinking. But instead of you to think negatively, you practice positive self-talk. Example, I am going to give up. I am not going to give up. I am in control of my feelings. This won't last forever. When you say these positive self-talks, you are empowering yourself against negative thoughts like I am hopeless, the whole world is against me. Whenever negative thinkings come, you change them to positive self-talks. This helps you to change your negative thinking to positive thinkings, feelings, and behaviors, hence helping you to develop skills to cope against depression. When next we meet in the next 4 weeks, we will discuss another therapy, which will be mindful-based cognitive therapy. So do you have any question to ask?
No.
So these therapies, like the therapy that I just discussed with you, CBT, you will be practicing it at home till the next time we meet. So that will be helpful to you to gain all the knowledge you need to use to cope with depression. Yes, my name again is Edwin. How are you feeling today? Good. Good. Last time we met, we said we are going to talk about mindfulness-based cognitive behavioral therapy. So, ha, so have you been practicing therapy that we did last time?
Yes.
Yes, I should practice at home. Okay. So that's so good. So mindfulness-based cognitive therapy is a modified form of cognitive therapy that incorporates mindfulness practices that include present moment awareness, meditation, breathing exercises. It is used to reduce relapses in people with MDD. And this is how it works. Put your two hands together,
Okay.
or like you are praying or meditating. Close your eyes.
Okay.
Think about all the beautiful things in the world, like you are in the serene garden, all the beautiful colors of the flowers in the garden and the birds singing. Even you remember what the Bible says about Jesus Christ when they took him to a very beautiful place to show him that all these places, belong to him if he only bows down to them, but he didn't do it. So you feel like you have all those beautiful things, with you. Take a nice deep breath. Slowly release it. So how do you feel? Good. So the purpose of this therapy is to help you change the way you are thinking, excuse me, feeling and behaving to a more positive ones, hence helping you to relieve the depressive feelings and thoughts. Do you have any question to ask at this time?
I do not. Do I need to continue my medication together with the therapy?
Yes, because this medication works better with the therapy. I believe you are in Zoloft 50 milligram uh, daily, and continue to practice this. When you get home till the next time we meet. So in that way, you'll be getting the whole benefit of therapy. Because if you don't practice it, you start forgetting what we have discussed, which is rational emotive behavioral therapy. So last time we met, so we say that's the therapy we're gonna do today. So from last time we met, so how you feeling?
I feel great.
Good. So have you been practicing the therapies we had last time?
Yes, I practiced both
Okay,
and I'm doing very well on that.
good. Thank you. Now, this is how this rational emotive behavioral therapy works. So what is this irrational? What is this national behavioral emotive therapy? This technique works in this way. It is a therapy that, a part of cognitive behavioral therapy, and this is how it works. Like you say, I don't have interest in doing things that used to pleasure me. This is an irrational thought or belief which can lead to major depression if this irrational thought is not changed. So we will use positive self-talk to approach this